compensation. I like to talk about easy things. I have a riddle. Actually, I have two riddles. Let me see who knows the answer. Why did the child care teacher cross the road? Yay, to get to her second job. I know you're gonna know this one. What two things in childcare are itsy bitsy? Spiders and paychecks, that's right. So these oldies but goodies are holdovers from the Worthy Wage campaign. And it reminds us that we have been at this compensation work for a really long time. As the theme of our conference implies, Opportunities Exchange believes that the time is right for change, and that not only is change needed, but we believe change is possible. So, let's have a conversation about early childhood educator compensation. But first, let's be clear that when we say compensation, we mean wages and benefits, right? So, we know that salaries are abysmal. It took about 2 seconds with a Google search for me to find these numbers on Indeed.com, which I thought was kind of interesting. And at first glance, you might think, wow, we're making pretty good progress. But if you look at the salaries and know anything about the local places, so obviously the two highest ones are Los Angeles and New York, probably two of the highest cost living places in the country, right? So if you're making $20 an hour, you probably are just barely surviving in those economic environments. So the point of this is that we're anywhere close to where we need to be. Now, what's worse than salaries? Benefits, right, in childcare. So the top graph, so as a country, we don't have a stellar track record on paying for health insurance or retirement benefits by employers. But roughly half of the employers in the US offer health insurance to their employees. And about a third pay for retirement benefits. What the bottom graph shows you is in childcare, it's 20% and 10%. 10% of folks who work in the field have any sort of retirement benefit from their employer. But, and as we were reminded by Gary this morning, the situation is really dire right now, right? We're sitting in this moment when a lot of the money that has sort of kept the field afloat for the last few years is drying up. So we know that programs are struggling. We know that programs are going to close. And it's really, it's an existential threat. And it's not like we haven't tried to solve this problem. So in the 1990s, in 1992 to be exact, actually, national leaders organized the Worthy Wage campaign. That was my foray into community organizing. For 25 years, I was the executive director of the NACI affiliate in Philadelphia, and we led the state's Worthy Wage campaign. And we had a strong sisterhood, by the way, with WICA across the country, who also had a very strong Worthy Wage campaign. And I'm thinking about you, Peggy Hack. So we wrote letters. We brought props like shoestrings and peanuts and pies to legislators and leaders. And we did leadership training. We held rallies. We did lots of things. And we made some progress, but not nearly enough. How many of you in this room were involved in a Worthy Wage campaign event or local effort? Right. All right. Quality rating scales. These also are connected to compensation because the thinking is, we have a quality problem in our field, and it's largely driven by the fact that We struggle with workforce issues. We have high staff turnover. It's hard to find and hire qualified people. So let's address that by working on program quality. And then we can offer higher reimbursement rates to programs that reach those higher levels of quality. Now, QRS did a lot to elevate the issue of quality, and it has had some small impact on wages, but not nearly enough. But how many people have been involved in QRS? A fair amount, yep. Let's talk about Teach. Teach and the companion program wages, right? That was absolutely an effort that goes on today that is trying to address the workforce problem. And Teach does a terrific thing in terms of helping people get education, and then they get a bonus or they get a raise. It does wonderful things to help us build the workforce. But the change in compensation has really only been incremental. How many people have been involved in Teach or wages? Quite a few, yep. So we have been at this compensation work a really long time. And we've made some incremental progress, but compared to where we need to go, we have a long way to go. So as a field, we've gotten really good at talking about the problem, haven't we? So I want to spend a couple of minutes talking about what I see are the problems. First of all, we have a math problem. We don't really know, too many people don't know what salaries should be paid. And what I see is that when I ask center directors or home-based providers, what should the salary be? What should the benefits package be? People are really reluctant to say a number out loud. And way too many providers don't know their actual cost by classroom, their cost of care by classroom, much less what it would cost if we paid appropriate salaries and benefits. But here's the worst part. In too many cases, we don't want to know. It's too scary a number. One of the biggest challenges that shared service alliances have, in fact, I was just having a conversation right between lunch and the keynote about how hard it is to get directors to engage deeply on finance, right? They really balk at the idea of sharing information, deep financial information about their program. Another thing I've seen is when we ask people, what is the health insurance status of your staff? Lots of directors say, I don't know, and I don't ask. And I don't think it's because they don't care. I think it's because they know or believe that they know that they can't solve the problem. And so not knowing is just a little bit easier. But here's the thing. If we can't measure it, we can't improve it. Now, there's a fair amount of controversy over who actually said this quote. I went down the Google hole for about 10 minutes before I finally realized it's not that important. True is true, right? If we're unable or unwilling to calculate the cost of care adjusted for real wages and benefits, then we don't know how much money we actually need, and we will be challenged in our advocacy to be effective advocates. So we have a math problem. We also have a scale problem. Most childcare businesses in this country are too small to hire an accountant or a bookkeeper, and so it's really hard to stay on top of collections. And they don't get regular financial reports, and they operate without a budget. They don't have an HR department, even though recruiting and retaining staff is the single biggest challenge in our field. No HR support to manage the hiring process. No one with expertise on benefits and other personnel issues. No marketing department to let families know about upcoming openings to keep the programs full. So the director ends up having to do everything, and it's impossible to do all that well while you're also trying to be a pedagogical leader. So what that means is one or the other or both of those tasks are going to suffer. And for home-based providers, staying on top of it Both administrative and pedagogical work while supporting families means a work schedule that is unrelenting, and in the end, not really sustainable. We have a scale problem. We have an efficiency problem. Here's the thing. Too many childcare programs are conducting business without using business software. If you can't pay teachers, why would you pay someone to collect paper timesheets or write out payroll checks or distribute tuition bills or go to the bank with deposit slips when all that can be done in a few minutes with automation? By the way, this is the part of the program that might start making you feel uncomfortable. But as the paperwork demands have increased through things like QRS and blended funding or subsidy management, too often our solution is to hire another person. In some cases, more of the personnel budget is being spent on administration and support than it is on educators in the classroom. This is a real graph, and I have to say, this is not an outlier. This is not that atypical to see when we really start to look deeply into budgets. We have an efficiency problem. We have a mindset problem. Decades of working with scarcity and trying to do more with no new resources has taken a really heavy toll on our sector. Not everyone and not every day, but too many of us have a pervasive sense in our field that we will never reach parity with K-12 teachers, or even worse, that the problem is unsolvable. I believe this despair is what drives the unwillingness to populate salary scales, to track information about staff health insurance access, and a myriad of other problems that we face. But believing that early childhood compensation is a problem without a solution is a huge barrier to our work. We have a mindset problem. And the one you've been waiting for, we have a money problem. There is a real funding gap, and a critical part of the solution is a significant public investment. So Build Back Better was far from perfect, but the basic framework was right, and that is you have to do two things at the same time. You have to expand financial assistance, right, subsidy, so that more families get help paying for childcare, and you have to raise the reimbursement rate so that it pays decent wages, appropriate wages. And that's done by calculating the true cost of care. So I want to talk for a few minutes about some solutions. Because this conference is focused on change, and we want to talk about change that is within our power. So let's look at some solutions. Solution one, we have to do the math. We had a session, one of the early first track sessions this morning was called Do the Math, Changing Early Childhood Educator Compensation. There is a methodology that we can follow to get to understanding the cost of care. And guess what? It starts with compensation. We have to begin at the beginning. We have to populate salary scales. And interestingly enough, you know, the work that was done through the whole Power to the Profession activity, the task force, gave us a roadmap for how we might do that, right? By creating educator levels, and those salary scales should be adopted for your own state and your own context. But basically what it said is, you know, lead teachers should have the same credentials as their K-12 counterparts. And guess what? They should be paid the same salary and the same benefits, whether they're working with infants or preschoolers or school agers, right? And so we have a way forward, and it starts with populating the salary scale with what it should be, not what we think we can afford, but what it should be. Then we take those salaries and we plug them into a budget, and we write our budget with all of our other expenses, and now we can start to see what does this work really cost to get to where we need to be. And then the next step is, let's take our budget apart right now and see, are we maximizing resources, right? Are we lowering, can we lower any costs? Can we, transfer some of our administration into automation solutions? Is there any way that we can bring more revenue in through either better collections, managing the iron triangle, or blended funding, right? Are there other sources of funding out there? So there is a way forward to begin to make progress on compensation. But for too long, we have only focused on the last action, on the getting new resources. And when we do that, we're left powerless to take action until someone else gives us the money, right? There is a lot that we can do for ourselves starting today. So I want to ask you or challenge you to think about these issues of salary scales. And if you're leading an alliance or you're working as a business coach, think about beginning with salary scales and compensation. So once you know how much money is needed, you need a plan to make sure that that money is coming in the door every day. That means you need expertise to manage the iron triangle and to tap multiple funding streams and to monitor enrollment and all of those things it takes to stay on top of those numbers. And if you're a home-based provider or a small center, you aren't likely to be able to manage all those tasks well and support children and families. And if you hire someone to do those things for you, you've just spent money that you needed to raise wages. So the bottom line is we have to, if we're going to boost wages, we need to think deeply about how to secure skilled administration without breaking the bank. If you're an alliance leader or a network leader today and your services are not helping small sites and home-based providers think deeply and make progress on the issue of compensation, ask yourself, what's getting in the way? Do you need staff with deeper skills in childcare fiscal management? Do you need HR support? Do you need better technology? Are you shying away from what might be uncomfortable conversations? Change is not about making people feel good. It's about looking problems in the eye and doing the hard work. So what changes do you need to make today to make sure that your alliance or your network can help close the wage gap? And if you're a business coach working with providers, how are you helping them address this most critical and foundational challenge of compensation? If you're starting or restructuring a shared services approach, think about your value proposition being really oriented around this idea of workforce and compensation. Think about how you can bring to this work, first and foremost, what are we going to do about addressing wages and benefits? If shared services is a solution to our broken business models, how is it addressing our most persistent business challenges? Remember, this morning we were reminded to fall in love with the problem and not our solutions. This is the problem. Drive efficiencies with automation. If you're trying to run a childcare program with pencil and paper or Excel spreadsheet, please stop. You cannot get the kind of data that you need, financial information that you need. You can't, do really efficient and effective operations if you're doing everything manually. We just have to change people's thoughts about this. And business software is a basic building block of running a program and helping us get to better compensation. Better business management means more revenue every day for every child, and that is how we're going to solve this problem. When you manage finance and operations, by the way, with automation tools, you have data to help you make good business decisions. I know the session today on benchmarks and dashboards was overflowing. We needed to bring some more chairs in, right? That's the kind of feedback that we need to get. We need to, if we're coaches, we need to understand the financial health of the organizations we're working with. And we need to help providers look at their numbers and understand what they mean and let that drive business decisions about how they run their program, how they set tuition, how they, all of those pieces. When you so, where am I? Let's see. Oh, think about this. If a home-based provider is able to reduce the hours worked in a week from 70 down to 60 because of automation, you've just given that provider an hourly increase. And the idea about including better compensation in an alliance value propositions, well, here's an example of how some of those dashboards can really help you help the providers that you're working with. Technology can help us know if we're on track. And using these dashboards and benchmark business metrics and showing programs that they can generate additional revenue that they need to boost wages, that's an essential part of the change strategy. Solution 4, start believing that this problem can be solved. I'm going to steal a phrase from the televangelist preachers who, you know, the prosperity gospel. Some of you know what I'm talking about. But they will often say this, name it and claim it, right? What we need to start doing is we need to start saying out loud and with conviction what teachers ought to be earning, what the cost of care is. Have you ever noticed how if something is said often enough, it comes to be believed, right? So we have to stop saying we can't solve this problem, and we have to start saying with conviction, a lead teacher with certification should be earning $60,000 a year and have benefits. Now, I've been in settings when I've said that and been driven out of the room. It didn't make people happy because they thought that, you know, I was just raising false expectations, I don't know what, but we have to start doing that. We have to start saying things like the cost of infant care in this country, full-time infant care in most markets, is $25,000 to $30,000 a year. What are we going to do about that? We have to face that, right? If we really want to get to this really is about the unit cost. And if we can figure that out and get there, we can solve this problem. So we have to change our mindset. We have to start asserting what the field needs and speaking it with conviction. So here's an example of how we can start to change the mindset. Early childhood people love standards, and we especially love pyramids too, I think. So my colleague, Amy Friedlander, and I worked on this as a way to help people start to get specific about benefits, right? And so in the bottom band, what we are saying with conviction and specificity is these things, that everyone who works in early childhood should have health care, health insurance, right? And that it is available, affordable, good policies, good products are available to everyone today because of the marketplace. By the way, that's only good for 2 more years. So, you know, we got work to do to build that out. But it's here now, and we should be leveraging those public dollars. But I digress. So on the bottom band, HR policy, you can see HR policy is that everyone will have health insurance, right? Everyone will have access to a retirement account. Now, we're not saying that the program has to put money into it, but we're saying at least you're going to provide access to everyone in your program, a vehicle, and you're going to offer maybe to do payroll deduction, right? But that is a basic benefit. We have to stop thinking that these are pie-in-the-sky ideas. This is just common decency. We can't expect people to work for 30 or 40 years in this very hard, very important work and get to the end and have no retirement savings. We have to stop that. We have to start saying that that's unacceptable, not the idea that people would have retirement benefits. And then as you go up, you know, you can read this. You can read this for yourself, but the idea is that we need to start creating some level expectations about what the field needs to do. So, I want to talk for just a minute about the ACA. Some of my friends are probably rolling their eyes. Here she goes again, talking about the Affordable Care Act. But it is an enormous public investment that we should be tapping into. The Affordable Care marketplace is really designed to help people in the exact income bracket in which our field is living right now, right? Anyone earning between $20,000 and $80,000 a year can qualify for significant benefits. Now, and I put some numbers up there. And by the way, there are calculators online. You can go online and play with it and put in some scenarios for your community and actually see what healthcare would cost and what the subsidy would be for particular people at particular income levels and family size. So here's what I want to say about the ACA. There is a perception that this is not great health insurance, right? It's like a welfare program, or here's another thing. If I'm a responsible employer, I have to provide health insurance for my employees. If all of a sudden there were a huge investment of public dollars for child care providers, maybe like ARPA funds, and people didn't tap into that, you would say you're crazy, right? So we have this huge public investment for low and moderate income workers. We need to leverage that. Now, I want to clear something up. OppEx is not saying if you're an employer, you shouldn't be paying for healthcare benefits. What we're saying is use the subsidies available on the marketplace and then take the money that you were going to send to Blue Cross Blue Shield. Apologies if there are any health insurance executives in the room. But if you were going to send that money to pay for private health insurance, take that money and invest it in things like health reimbursement and health savings accounts so that your employees not only get health coverage, but they get help with out-of-pocket costs. You can help pay the premium. You can help pay for prescription drugs or any co-payments that they have. Take some of that money and put it in a retirement account. Take some of that money and hire some additional staff so that you can give them paid time off. Do you see where I'm going with this? It's not about walking away from our responsibility. It's about being really smart and strategic. And there's money out there and we need to tap it and we need to use every penny that we have in the best possible way. Okay, I'm going to step down off the soapbox. And I'm going to talk about getting more money. So all of what I have said is about using resources more wisely. Believing that we can solve the problem, leaning into automation, none of this takes away from the fact that we need more funding. Childcare is a public good and it needs more public support. And you can all cheer at that statement. I'm going to say it again. I'm going to give you a chance. I'm teeing you up. Childcare is a public good and it needs public support. So what we have is a both-and situation, right? Too often we have said and we have believed that the only thing we need is more money. We do need more money, and we need to do all of these other things. And here's some good news. If we do these other things, we will have a positive impact on wages. We'll move more educators into having benefits, and we will better understand the gap in funding so that we can articulate more clearly to the outside world and move closer to realizing that goal of getting what is really needed. Losing Build Back Better was a setback for sure, but the good news is it hasn't stopped progress, and some states are moving ahead in really exciting ways. I'm looking at you, Vermont. So if you haven't heard, yep, Vermont. And believe me, it's not because I moved there. Boy, would I love to say that. I'm happy, I'm delighted to be in Vermont. There has been a really robust advocacy effort in Vermont led by the AUIC and Let's Grow Kids over a number of years. And here's what they just did in Vermont. They just passed legislation that will raise new funds for childcare through a payroll tax, expand subsidy up to 575% of federal poverty level. And that's not all, and raise the reimbursement rates to cover the cost of teacher wages at K-12 parity, wages and benefits. So that's one state. You heard, about a year ago, you heard New Mexico did some groundbreaking work in creating a permanent, dedicated funding stream for early childhood education. Yes, New Mexico. Kentucky and Iowa have done something that I really want every state to think about doing, and maybe we'll get it at the federal level, which is to make subsidized childcare a benefit for staff working in a licensed childcare program. And think about what that means. Not only is that an extraordinary benefit for the employee, but it takes the burden of having to subsidize it off of the director's shoulders, right? And so it's a win-win. And in the face of having a terrible workforce crisis, this just makes sense. By the way, I don't think Kentucky's here, but Iowa is. So Iowa's doing a ton of things. Yay, Iowa. Many states have made significant improvements to their reimbursement rate based on cost modeling. In our session this morning, someone from Washington State was there. Somebody, Washington State, right, who talked about your infant reimbursement rate going up to 20.
For some regions, is
$24,000 a year. That's a decent reimbursement rate for infants, right? So we are making progress. The Federal CHIPS Act has a provision that businesses who receive federal funding will need to provide high-quality childcare for their workforce. Let's make sure those programs have the adequate resources to pay the wages that need to be paid, right? Local government's also a player. Philly Pre-K folks here? Pre-K for SA, San Antonio, here, yep. So local governments are also making these investments. We must work for a bigger investment in early childhood education at all levels of government. And if we are ready with salary scales, with efficient operations, and a clear understanding of the cost of care, that will help us use these new resources in the most effective ways. Now I'd like to call a few colleagues up to the stage. Let me tell you who they are, and then they're all going to come and take their seats. So Mary Graham is the executive director at Children's Village. It's a childcare program serving over 400 kids in Center City, Philadelphia. Children's Village offers compensation that comes very close to K-12 parity in wages and benefits, including health care, retirement, and paid time off. Mary? Dr. Theresa Hawley is the executive director of the Center for Early Learning Equity and an expert in early childhood programs and systems that support school readiness and social competence of young children in poverty. She is deeply engaged in cost modeling work to inform the ECE sector. Welcome, Theresa. And Kelly Turner is joining us. Kelly is the Vice President at Civitas Strategies, which offers high-impact business coaching to providers and support and training for intermediary staff engaged in business coaching. Welcome, Kelly. All right, I have questions.
Okay.
All right, Mary, we're going to start with you.
Okay.
And we promised this one to Jackie Cowell, right? So your program offers competitive wages and benefits to your teaching staff, and your staff turnover rate is really low. However, we all know that school jobs, school-based jobs, have a 10-month year and a retirement plan and some things that you're not able to do, you're not able to compete. So I know that occasionally, and it really is only occasionally, you lose a teacher, you move them up the career ladder and they get certified and you lose them to the school district. Can you talk about this experience, and can you tell us about what it means to have a positive work environment and how that impacts that? So I know you have a story to share.
So yes, we grow our own staff, as we call it, and we hire folks who want this to be their profession, and we do that with anyone we can. And it's wonderful to see through Teach somebody come in as a classroom aide or a part-time substitute, go to school, get their associate's degree, get their bachelor's, then go get certification. One of the things that Sharon talked about was a salary scale, and our salary scale shows that with more education, you get more money. There's a path to success. And we have lots of people who do that. And occasionally, but it does happen, they get an offer from the school district that they can't turn down. And we had that case this year. Someone who I hired, she had come from a chain childcare program where they made her an assistant director. She said, I didn't want to be an assistant director. I wanted to be an assistant teacher. And she wanted to be successful, and she wasn't successful as an assistant director. She came to us, and we nurtured her. And for years, she said, I don't want to be a lead teacher. But then we gave her room for growth and opportunity to grow, and she got her bachelor's. And I said, you could be a lead teacher, you could be a certified teacher. And she did. And she was so excited. She graduated in May of last year. I mean, it was incredible. And as part of Teach, she had to give a year's back. And then she resigned. And she said, I'm so sorry to do this. She couldn't even do it in person. She was so upset. She'd been with us for 22 years and said, I just need a better schedule. I have my grandkids to take care of. I need to work 10 months a year. And I need to make a little bit more money. And I said, great, I understand. But I was really clear. I said, when you leave a position, always leave the door open. Make sure that you leave in a way that you can come back. And I offered her the best. And school started. She went to orientation. She was on TV. You know, I'm so excited. I'm getting to do something. She got hired by her neighborhood school district, by her neighborhood school, as an ESOL teacher in a kindergarten program. She's, you know, Latino. She's Spanish-speaking primary language. So this was a dream. And by the end of the first day, she called us and said, I have to come back. And she came back not because, I mean, she came back for lots of reasons, but one was, she said, I did all of this orientation. I went and I met the principal, and there was no support there. I didn't have a colleague. I was told, you have, 20 kindergarten children. You might have them. You might be moved to another school in a month when we do leveling. So here she is, doing what she wants to do. And I said, and we had this conversation. I said, so tell me what made you leave besides that? And she said, well, part of it is my family said, now you can be a real teacher. I said, you are a real teacher. And she said, I knew I'm a real teacher. And the other thing is, she said, I know what's right for children. I know what's developmentally appropriate. And it is not developmentally appropriate to take these kids and put them in desks where they can't play, they can't have water, they can't have food in the classroom. That's not how you educate and nurture children, and I couldn't live with myself. So she came back, and she said, you made me feel part of a team. We have shared leadership stuff at our center. We get teachers involved. We have lots of problems. People will tell us all the time. And Mom's saying, Frank, what's your solution? Like I don't have all the answers. We have to do this. And she came back. We've had that happen a few times. And it's great. And we even have some staff who come back, who stay with the school district during the school year and then work during the summer. And I say, why you come back? They said, because I want to teach. I want to be this is what my dream is. And I'm not getting that in a system that doesn't see them more than a peg.
So I think it's really important that as we're having this conversation and sort of looking to the K-12 system and saying, that's where we need to go, that's where we need to go, we need to understand that compensation is necessary but not sufficient, right? That what we have in a high-quality early childhood program around supporting reflective practice and growth as a professional and authentic pedagogy, all of these things, we have to hold on to them fiercely and know that's our competitive advantage, letting teachers be teachers.
And also recognizing that they have families. And, we're open from 6:30 to 6. We have to cover a lot of days. And, we do what we can. So everybody, you have to leave this time, we'll do that time. We make it work because we see that person as integral to the success of the center. I mean, people are there because of Nancy. The kids are there because of Nancy, and the parents are there because of Nancy.
Thank you, Mary. So, Theresa, I talked about the importance of our sector doing the math. You've done a lot of work. You've done a lot of math. A lot of work on cost modeling and financing. So from where you sit, what's your reaction to this idea of doing the math?
So it's absolutely critical. I don't really get how anybody could start an early childhood program without sort of doing the math. I spent 15 years in state policy, state government, but before that I spent 10 years as a grant writer. And I would come to a program that was looking to do a Head Start grant, or maybe they were going for some other kind of grant. And my mantra was always, do the budget first. The first thing we're going to do here is to figure out what it is that you say you want to do and how much that's actually going to cost and whether this grant is actually going to cover the cost of that. We do not wait to the end to write the budget in this grant writing cycle. And then I went to create a new early childhood center myself. The first thing I did was write the budget and to try to figure out how are we going to get the resources for this program? What is the staffing that we need to have? What are the salaries we need to pay? What are the other costs that we're going to need to have? Because if you're not building in that sustainability and that understanding of your business model right from the start, it's not going to work. So then I went into the governor's office to work on state policy. And again, the first thing I did was did the math. And I did the math because there was just overwhelming sense of we know what we need to be doing here and we should be making all these impacts on children and families. And there's a lot of frustration in our state after 15 years of expanding state pre-K. People are like, why aren't we seeing all the results we want to do? I'm like, let me do the math. Did the math, and I said, okay, the system that we're all talking about having here costs about $5 billion a year. And the money we've got for this system here is about $1.2 billion a year. I can tell you why we're not having the impact that we want to have. We did the math, and that made a big difference in what we were thinking about as our next steps in the process. Another little story about where doing the math really made a big difference. Again, back in the governor's office at the beginning of COVID, and we had then engaged in doing a whole cost model for our state, understanding what the cost of care was. And that was going on before we started COVID. And found ourselves in the beginning of April after a crazy March of having shut down the entire child care system and reopened it over the course of a weekend with a whole new set of regulations. In April, we were starting as a governor's office to say, what does reopening Illinois look like? And it fell to me to say, what does it look like to reopen childcare? Well, I remember back then, we didn't know whether it was safe to have still 20 children in a preschool classroom or 12 infants in an infant classroom. And so we were going to say that reopening, you had to open with smaller group sizes. And so I was able to, sort of raise my hand in staff meetings and say, childcare is going to go under because they are not going to be able to survive if we make them have less revenue. They have no other way of staying open. And the question came to me immediately, how much money do we need? Because I worked in Illinois and we had a governor who really wanted to support that. I had an answer. I said, I need $700 million, please. Okay, it wasn't a great answer, right? I mean, it was a well-founded answer. I said, I need $700 million to keep these programs open until a year from now. And I knew that because I had done the math, and I had the tools with a cost model and all that to do that math. What I got back a week later, honestly, a little bit to my shock, was we cannot give you $700 million, but here's $290 million of money that was not federally earmarked for childcare, but was the state earmarked. Some of that it's federal, it's rich childcare, and we were able to get those resources out into our childcare programs far more rapidly than any other state in the country. And we were able to then advocate up at the federal level to say this money needs to continue, and that's sort of what turned into the child care stabilization grants, because we knew how to do the money. So doing the math really gives you those tools. And one last quick story about it is that in Illinois is we now then say, what's the next investment? Well, we had done this, we had a funding commission that seriously did the math and came up with the answer of we actually need $14 billion in order to create the full early care and education system that our states need, which was too much for people to interact with and to bear. But because we had the tools, we were able to scale, kind of chop that up into pieces and able to say, if you want to raise the wages of childcare providers by $4 an hour, that would cost you, right? That would cost you, and the answer to that was about, I believe the answer to that was about $700 million. So we didn't have the ability to go all the way to $700 million, but we were able to get and convince the legislature and others to move us to close to $300 million. And then we were able to say, all right, we can make that leap. We can make that leap today. So it's about doing the math to create these little chunks that you can actually make your system move forward.
Wow, thank you so much. So I have a time check question. Are we ending at 15 or 2:30? Sorry. Somebody check the program for me.
Sorry. 2:30.
2:30, good. Because I'm going to turn to Kelly in a minute, but I'm going to put you on notice. We have 2 open microphones. And I have a feeling people may have thoughts about the topic of compensation. So I'm going to ask Kelly to tell us about some of her experiences. And then if you want to come to the microphone, you have a question, you want to challenge something, ideas, thoughts, whatever, the mics will be open. But first, Kelly, as one who supports providers and business coaches on this issue around running sustainable businesses, can you speak to the real financial impact of how we can use current resources more strategically and leverage all available resources? What kind of impact can these strategies have on the financial well-being of providers?
Absolutely. Can I just say, though, this is the first chair I've sat in today where my feet comfortably touch the floor. I've been really enjoying the time here. But no, in all seriousness, I think that the message is pretty clear today that there are existing resources and opportunities that we really need to tap into right now. The question for everybody in the audience here, if I told you that you could give all the providers in your network a 21% raise and give them access to affordable, employer-sponsored retirement. Anyone interested? Okay, a few people, yeah. Well, this is something that can be done everywhere, and it is so critical to pay attention to right now because it is something that is existing, It is money that is already in existence, and we just need to help people tap into it. So the work that we've been doing at Civitas Strategies, if we look at a sample that represents the cases that we typically see, so some centers, mostly home-based providers. Our tax strategies are saving providers on average $7,600. If you take that $7,600, invest it in something with a moderate return, like 401k, in 20 years, that's going to be $250,000.
Wait. I think I need you to say that again. And I think can we turn her mic up a little bit? I want you to give those numbers again.
That's $7,600 from using these tax strategies on average. And I should clarify, this is tax savings, so we're talking refunds and credits. This isn't even going into deductions and other opportunities at this point. Just tax savings, $7,600, that if you put into a 401k, would be $250,000 in 20 years.
Yeah. Now you would make that investment every year, right? You would put that amount of
Right.
money away every year.
Right, but
and
a
you'd have-
$250,000 just off the one. So now if you imagine that you're able to do this every single year,
Oh,
Yeah.
yeah.
I'm in the wrong business.
Do the math, Sharon.
Yeah, do the math, Sharon.
Do the math, yeah. So I'm sure people are wondering, well, why on earth are we not doing this then? Why are people not taking advantage of this? And the answer is simply that people don't know how. They do not know how. They don't know that they can, right? So there's a big disconnect that's leaving a lot of money on the table. You have childcare businesses that don't know how to maximize their tax savings. And frankly, you've got a lot of help out there that doesn't really truly understand the nuances of childcare. And they don't know how to help them do this, right? But this translates to a 21% increase in net profit on average for providers, which is, I'm sure something people would like to have and keep of their own, right?
Wow.
So when we think about the barriers to this, number one is the information. People need to get that information. Number two is the time. I've already heard a lot of wonderful things out there happening where we're leveraging technology to save some time and have a few resources I'll share with everyone as well. But the other is trust, and that one's tricky because it's very difficult to just trust anybody with your tax information. But $7,600, we really need to get people understanding how they can do this.
Yeah, absolutely.
The next part of the strategy, what do you do with that $7,600? Well, this is where retirement comes into place. There's 3 ways that retirement overlaps with tax strategies. One is deductions for the contributions, through tax credits and refunds for starting up the plan in the first place. And then the big one is the strategic use of the money that we found using those tax strategies to invest in that retirement. So for example, if we had a childcare business owner that wanted to open up a 401k for her childcare business, what people don't know is that she could access a tax refund for the administrative costs for the setup and maintenance of the plan, a tax credit for starting the new plan if she's under a certain income level, and then the deductions also for the contributions. So what you end up with after that is a 401k plan that is almost entirely covered by tax refunds, credits, and deductions. So if we go back to that 21% that we also found with the tax savings, not only are you going to be able to cover the remaining portion of those costs, but then you've got money left over to invest yourself, right? So when we go back to that $250,000 over 20 years, that was the math with just the one time. So imagine if we're doing this year after year. Imagine if we're helping people understand how to get this help year after year. When you look back at that slide you had, Sharon, with the 10%, I feel like that gap doesn't look quite as scary, and we can start to work towards closing it.
Right.
I do have a few resources because, the big piece is the information, the time, and the trust. And the resources that I know of that are available, the first one, I don't know where Kelly Matthews is, but there she is. There is a self-assessment app developed with WECA where tax providers can put in their Schedule C information. It will give them a printable report on tax opportunities that they've missed that they can apply next year. They can take that to their tax preparer. It takes 15 minutes for providers to use. Coaches can use it as well. Another one, I don't know if she's here, Natalie Renew, Homegrown Child Care, has been investing for a few years now in a tax workbook for family child care providers that walks them through the process of filling out their tax forms and understanding tax strategies. Again, that's something that they can take to their tax preparer or work on if they're choosing to file on their own. Through a lot of our coaching work directly with providers, we've understood that retirement can be tricky to navigate. And so working with OppEx, we've found that we can really narrow it down to a few choices based on a few questions. And we've devised an app at Civitas where, again, coaches and providers can go, enter in a few pieces of information and get directed to a narrower choice of retirement opportunities that they can select for their business. Fourth, for those of you who were not able to attend, I heard it went really well, but Gary Romano had a session earlier this morning on taxes and incorporation. Those slides are in the conference app. He talked a little bit more in depth about some of those tax strategies. I will also say that if anybody has any interest in learning more about taxes, Gary will talk to anything about taxes. I did have the privilege of sitting next to him on a 5-hour flight to Phoenix, so you can just imagine the tax conversations that were had. But in all seriousness, he's super passionate about it because you can see the impact that it will have if people could just understand how and why. So again, he's over here. I recommend finding him. You're going to be in it for the long haul. Bring a snack, maybe. Yeah. But he'd be happy to help.
Thank you so much, Kelly,
Absolutely.
Teresa, and Mary. So they're going to stay here with me, and the mics are open, so it's your turn. What makes you uncomfortable? With what do you agree? Do you have any experience with any of these strategies? Where have you encountered challenges? And any other question or thought or idea that you have on your mind. So the 2 mics are open, and it looks like they're empty. Well, that's
I have a challenge.
all right.
I want to be able to get a group of providers to be able to appear on Shark Tank.
On Shark Tank.
But you're going to have to know things like, what is your cost of care? What is your profitability? What is your forecast for the next 3 years? And I'm challenging that because most people don't know those answers. As you said, they don't have budgets. They don't know how to prepare a budget. And when you ask someone, in Philadelphia, there's the Fund for Quality. You can get $300,000 to do renovation and expansion, but you have to have a budget. And that scares people. So I want Shark Tank. Who wants to go on Shark Tank?
I have a question for Theresa. You talked about doing the math, but I'm just kind of wondering how did you do the math? Like, what kind of data did you need? What did you use for those calculations?
Well, shameless plug, come to my session tomorrow afternoon, or tomorrow morning, I guess it is, because I'll be sharing a lot of details about that. But really, I want to say, do the math. I just want to be very clear here. The math is addition, subtraction, multiplication, and division. There are not even any exponents in it. I mean, you really don't have to.
No
it
algebra.
It's not that complicated. So how did we get that kind of information? There's a lot of ways that you can go about it. I know a lot of states have now engaged in what they call either narrow cost analysis, or they're doing a cost estimation model that they're trying to do an alternative cost methodology. So there's a lot of conversation now about what is the information that we need to be gathering, but it really comes down to some very simple things. Salary schedule, absolutely. As well as what are the benefits that you're going to be paying, and how does that vary by salaries. A lot of that is pretty darn straightforward, and you can figure it out. staffing pattern is absolutely critical. And that gets to not just what's the staffing pattern in the classroom, but what are you assuming is that administrative staffing, or what are you assuming is the out-of-classroom staffing? And then just all the other expenses. And honestly, all the other expenses are pretty straightforward too. I mean, it's food, it's materials, it's supplies. These are things that you could actually write a quote-unquote grocery list for to figure out what it is that it takes to create a program. And honestly, that's really all there is to it. And you can kind of build it out. And the wonderful thing about Excel is that you can ask a million what-if statements from it. And that's what we'll be talking about tomorrow, about how you can use a tool like that.
Thank you.
Yeah, thanks. I am actually really shocked that there are 2 empty microphones, because so that means either people agree with everything and you're ready to go do it, or maybe you were listening to music while we were talking about this. So, another comment, question?
Sure, thank you. My name is Rebecca. I'm from an organization called Growing Up New Mexico. So we work in New Mexico. We've been thinking a lot about compensation for the workforce, trying to do the math. I think there's been a lot of work on this, ranging up to 90 million is sort of one of the requests that's coming for this year. And I was actually curious if any panelists have thought about sort of framing the narrative in a way that gets us to really, as opposed to like parity with K-12, which is obviously a huge goal. Has there been sort of successful examples of how we even break through that particular ceiling? When I think about retention or loss of folks to the K-12 workforce, has anybody done work around, maybe we go beyond K-12? Like, what is the standard we should really be pushing for, and not to limit ourselves to what's often categoriized maybe as like also a system that needs improving. Would love anyone's thoughts on that.
Yeah, you want to take that?
Yeah, I would say when we work with the state and we start to set up a cost model for the state, yes, we absolutely look at the salaries that are being paid in the K-12. I will tell you that is wildly different across states and within states. What people are making is K-12 salaries. Not really sure that that's our best benchmark that we should be going to. Why don't we look at what does everybody in the economy with a BA make? Why don't we start looking at that as a benchmark? And honestly, let's be, if we're only requiring folks who are teaching in the classroom to have a couple of credits, of college credits, we actually have to look at what is the going rate for somebody who has that level of education as well. And that helps to anchor where our funding is. So it isn't, and the same with benefits. It's not just about what does the K-12 system do for benefits. Some people will be like, why can't we get our child care teachers into the state pension program? Well, as a state policymaker, there's a lot of reasons why you're probably not going to get them into the state pension system. It doesn't mean you can't provide a retirement benefit that is comparable to what the broader economy is providing.
Right, thanks. Yeah, I kind of cringe every time I read an article or hear somebody talking about low teacher wages, knowing they mean public school teachers, right? And I think, that's our gold standard, right? But I think we have to sort of keep our eye on that as well. Louise?
Yeah. I was just saying an empty mic, I was really listening. I was thinking about when you said name it and claim. What is it?
Name it and claim it. With a Southern accent. You say it with a heavy Southern accent. But
okay.
Yeah.
And I was thinking about what you said, Kelly, about taxes. So I think part of the problem, with what we have with tax prep is that whole word scares people. And there's a real perception that it's better to get money under the table, cash payments. So I just wonder if we couldn't name tax prep as compensation, like say it. Exactly like you said it. Maybe we need a big education piece around, you want to raise your wages by 20%, come to this work. Because I think people do not correlate taxes with higher income. And that might be a message that we really, really need to reinforce.
That's a great point. I think when you hear tax, you think, what do I owe, right? Not what could I earn, what could I put back into my business? Yeah.
And I want to say something to the state administrators who are in the room. I think part of your job as a state policy person is to make sure your state draws down the most federal money it possibly can, right? And that means making sure that your child care economy is drawing down as much of federal taxes and as much child health care, Affordable Care Act subsidies as you can. All of that is got to be part of what you see as your job to bring those resources.
Well, I really want to thank, yeah.
I don't know myself, but I'm really curious, Theresa, specifically, when you're doing like a cost modeling and whatnot, how do you account for the social determinants of health, essentially the cliff effect that very may well occur? And honestly, as an example is, you increase their salary and suddenly they're not eligible for energy assistance. So that's, thousands of dollars they lose a year. So that benefit, while it's nice, still has that cliff effect where you're still kind of back in the same spot because they're losing benefits as their income is going up, so it's not substantial enough to create real self-sufficiency.
No one could hear that question.
Yeah, so the question that was being asked was really about how do we account for the benefit cliff that folks, because we have such a low income workforce who is being subsidized currently by a lot of public benefits, how do we make sure that we don't have people, worse off? I am telling you that McDonald's and the gas stations and Walmart and all those folks are not saying to themselves, how do I make sure that my folks don't fall off the benefit cliff, and so I don't want to raise their wages because they're going to fall. I think that it's a mindset trap that we get into, that somehow we need to make sure that everybody that is able to stay on these kind of public benefits. Yes, do we need to think about them? Yes, do we need to account for them? That is a challenge that those systems need to be dealing with because they have created these cliffs. It is not, again, this is just me saying, I don't think it's on the child care industry to solve the problem that we've created benefit cliffs in all of our public.
So I want to thank our panelists. And as we end today, I just want to leave you with this thought. I'll give you a second to read this terrific quote. So we really are on the cusp of a sector transformation, and there are specific and meaningful things that we can do starting today to have an impact on compensation. And in making things better right now, we're also laying a strong foundation to position us for the coming day when early childhood educators take their rightful place alongside all other education professionals. So let's make that happen.